Our next speaker is Dr. Sandeep Naphade sir, and his topic is present concept of wound care management. And to conduct the session, I would like to invite Dr. Akshaya Jain, co-founder and CEO, Scintillating Seatin Cosmetology Trichology Institute, practicing at Akshaya Healthcare Clinic. We welcome you, ma'am. And Dr. Dhairashil Patil, family physician practicing at Sumeshwar Clinic, Pankad Club Road, Baner. I invite our speaker, Dr. Sandeep Naphade sir.
Hello.
Good afternoon all. I'm Dr. Sandeep Naphade is a very well-known plastic surgeon. He's completed in MS surgery and completed MCH in a plastic surgery. He's a head of the department in the KM hospital as a plastic surgeon. He's a senior consultant in the Sanjeevani Medical Point Hospital. So you can point it with this one. He has a 25 years experience in a plastic and reconstructive surgery that includes hand surgeries, burn surgeries, cosmetic surgeries, microvascular surgeries including reimplantation, more than 500 AV fistula surgeries for CRF patient. May I request Dr. Sandeep Naphade kindly deliver his speech.
Today my topic is relatively simple, wound management. When topic is simple, it becomes very difficult for a presenter to present that. But I would like to go beyond our routine things like hydrogen peroxide, betadine, usol. So let me introduce recent changes, recent concepts which are there available, and we are routinely using these concepts to have a good outcome. It has decreased the hospital stay, it has increased the patient's convenience, even financial burden has been reduced because of these recent concepts in wound management. We know that traditionally we have classified wounds into these 4 categories. So there are different methods of classification for wounds. For example, for all chronic wounds are classified like this: clean, contaminated and dirty. Like other classification for pressure ulcers, like depending upon the grade. For burns, again, we have different classification. The goal of classification is to simplify the extent of the wound. The team should know everything. When the surgeon do dressing and goes for different thing, his colleague will come and see, and he will come to know what is the exact problem with this patient and what should be the line of management. So classification, these are simplified to different methods, but for practical purposes it is to bring unanimous decision among the team. So regarding the concept of wound healing, there are 3 main concepts, like surgical aspect of wound healing, different dressings available, and biologically active products available at present situation. Wound management has 4 paradigm. First is tissue dealing, like wound infection. It's called as time concept. I is for infection, inflammation. M is for moisture, how much is the moisture, and E is for epithelialization. Why moisture is important? Because we know that the rate of wound healing doubles if we provide moisture to the wound. A dry, desiccated wound can lead to impairment of the function of vitally important structures like tendon, nerves, whereas the moist wound will improve epithelialization and covering will be done faster. Infection control, as we all know, that we go for IV antibiotics, we go for topical antibiotics. There are wound dressings which can release antibiotic at the area where it is needed. So in a complicated wound, complicated patients like with CRF and other comorbidities, when we cannot give maximum or therapeutic doses of IV antibiotic, these topical methods are very well take over that part. So we are now routinely using stimulant. My orthopedic colleague must be knowing that the stimulant is degrading product where we can add antibiotic of our choice as per culture and sensitivity. We can prepare stimulant beads, we implant it to the wound and to the area where blood supply is optimum. So as time goes, the stimulant will go on disintegrating and releasing the antibiotics. So maximum concentration of the antibiotic will be available at bedside where it is required. Nowadays, silver is also fascinating. We are using silver for years, like for burns, we are using silver sulfadizine, but these silver salts will have its own problems, like they will cause pigmentation to the wound site, they will form a layer which is very difficult to remove, and at times it becomes painful also. Now because of nanotechnology, the aqueous silver or silver releasing ion solutions are available. A classical example is Acticoat, where we use it for pseudomonal infection, and it's two layer. So wherever the exudate is there, then it will promote dilution of the aqueous silver ions into the wound, and then that silver ion will take care of infection. Now last 5-4 years, silver like was a Ramban upay, but now today we have seen some resistance to silver also. So the concentration of the silver should be optimum, that it should not hamper the wound healing also. Hydrophera blue, it's again antibiotic containing dressing, where methylene blue is impregnated into the foam. It absorbs the exudate as well as it will provide methylene blue as topical antibiotic. There are other novel dressings like Therapter Novo, where they have potential for binding the ions, negative ions, which are usually present on bacteria. They will attract that selectively and they will provide some kind of antibiotic effect at the wound. Negative pressure wound therapy, this has changed the present concept of wound healing. Negative pressure, here there is a foam which is attached to the canister, and in turn it is attached to a pump. All exudates are collected into the pump. It's a closed system, it's a one-way system where infection cannot go from the canister to wound again. The advantages of negative wound pressure therapy is that it will take away exudation, it will promote angiogenesis, it will keep the area dry and neat and clean for the patient also, and wound healing rate is almost double. Skin substitutes, these are sophisticated dressings. Commonest available with maximum benefit is Myriad and Endofoam. Apart from that, there are other like Metriderm, Integra, Polynovo, BTM, Collagen, Autologous Skin. These have changed the concept of wound healing. Usually we have to do once or twice a dressing with available routine Sofra-Tule or gauze dressing. But this self delivery system with antibiotic, we need not change the dressing daily. So after 4 or 5 days we can change the dressing. So it becomes very patient friendly. Hyperbaric oxygen and topical oxygen. We know that most of the chronic wound, the hallmark is less oxygen tension at wound site, and then because of that all cascades of chronicity will start. So how to overcome that? The solution is hyperbaric oxygen chamber. So there are cycles where patients are kept in this chamber for 60 minutes, 150 minutes like that, and they will deliver oxygen at least 1.5 to 3 times higher than the atmospheric pressure of oxygen, so that at that particular time the oxygen concentration in blood is very high, and then that will deliver to the wound, and that will break the cascade of chronicity. But there are some limitations for hyperbaric oxygen therapy also, because first is it's costly, second is some claustrophobic patient will not accept this, third, the patients with some lungs issue cannot be subjected to this therapy. But those patients who is having areas of interest in inside body where surgically access is not possible, like mid-brain, intra-abdominal problems, where middle ear, where access is difficulty, this has changed the outcome very well. Another version of delivering oxygen is topical oxygen therapy. This is usually for diabetic foot patients. There is a polythene cover which is attached to the tubing, and high pressure oxygen is delivered to the wound directly. So oxygen concentration peri-wound area is high where the blood vessels are good, so capillaries will take oxygen and improve the wound healing. Acute wound that ways are very easy for a plastic surgeon to treat, because these are like accidental wounds most of the time. The pathophysiology is maintained, healing that way is predictable. But chronic wounds are the problematic wounds, where we know that the chronicity will lead to lingering of many things, cascades of inflammation continues. They will promote one problem to another, and this add to the misery. So infection, ischemia, increase MMPs. MMPs are matrix metalloprotease. These are enzymes which digest the proteins. Routinely, we know that wound healing occurs as time goes. Predictably, if we see 10% of the shrinkage of the wound per week, we can assess that this is a good wound and going to eventually heal. But if this wound is not healing, then the problem is somewhere else, and that most probably the problem is with MMPs. What happened? Body is trying to promote epithelialization, and body is trying to build up basement membrane also. But these enzymes digest everything. So with each and every dressing, the wound healing gets hampered. So if we have a control on these MMPs, the wound healing process will be augmented. So I'll quickly go through the basic problems with commonly occurring medical conditions. For example, we know that diabetic foot ulcers are like, they are contributing more than 50% of the all chronic wounds, and that cause for all chronic wounds. The hallmark of chronicity is here because of neuropathy, vasculopathy, chronic osteomyelitis, and high exudating wounds. Whatever you want to do, it will add on the problem. As shown in this picture, patient has tendo-Achilles injury. So reconstruction with reverse sural flap was planned, but unfortunately even this reverse sural flap gets some infection and ischemia. Another problem is vasculopathy. So if we see diabetic patient with this kind of appearance, it should alert us. We know that the foot is pale, ischemic, there are no hairs, like this indicates chronic pathology. On the top of that, blister indicates that there is an impending vascular compromise. We know that skin is biologically least active organ. So when skin is hampered, it means underlying all structures are compromised. If we see this kind of structure, then we know that this is a problematic patient and this is going to land up in chronic problems. So we should be ready for that problem anticipation at this time only. When we do excision for different conditions, for example, in this case, malignant melanoma, a 92-year-old male, not suitable for reconstruction, wound is covered with, again, one of the best available advanced wound healing method, Myriad. It's called as bioscaffold. Myriad is extracellular tissue derived from sheep gut. Why they have chosen sheep gut? Because sheep gut turnover is very high. So the biosignaling at that point is very high. So with the help of tissue engineering and nanotechnology, they process that sheep gut so as to remove all the cellular content which are antigenic and keep the remaining things like basement membrane, vascular channels intact, which will promote healing very fast. Here you can appreciate the rate of epithelialization improving very fast. In the first diagram, you can see the zone of epithelialization is migrating. In the second slide, you can appreciate that everything has healed. The weight bearing part is healed without any surgery, without any intervention, and small ulcer is there that is going to heal eventually. These are necrotizing fasciitis patient, debridement done. Patient was in ICU on inotropes, not suitable for surgeries. In these cases, again, Myriad was used. It promotes granulation, and eventually, after 4 months, wound healing can be achieved. Another method for wound management, like contour management, is 3D printing. We have seen that what Muker has done. So after maxillectomy, we have seen lot of deformities leading to diplopia and other cosmetic problem. So now we can actually design the implant so as to take care of volume precisely. This is because of 3D imprinting technology. Video is not playing. Anyway, one more case of chronic osteomyelitis following diabetes. Partial calcinectomy was done, negative pressure wound applied, skin grafting done, biologically active Myriad applied. Chronic venous ulcer also responds very well with this advanced method. BTM Polynovo is one of the newer available extracellular matrix, but it doesn't have any biologically active molecules. It just provides structural support. It used to control the contour deformities. Post CABG sternal dehiscence, we know hallmark is again osteomyelitis, infection, ischemia, all necrotic bones, all hardware has to be removed. Then only we can able to get results. Acute wounds, extensive deglowed injuries where bone is exposed. In the same setting, we can harvest the skin graft from the deglowed injury areas and cover bones, exposed bone. We know that intact periosteum is able to provide nutrition, and if we are able to cover the bone, the later on reconstruction becomes very easy. One more case of extensive deglowed injury, burns. Burns is again a hot topic. It's itself a topic for discussion. It requires a lot of efforts, team efforts from surgeon, physician, physiotherapist, dietitian, and everything. Usually we used to use collagen, which is also biologically active dressing material, but it takes around 3 weeks for epithelialization. But now these endoforms can able to heal these wounds within weeks. Other wounds we following resection of a tumor can be very well covered with this advanced wound method. Here the scope, microscope is a good aid to visualize all the fascicles and isolate things and cover the wound. Reimplantation. So this is how plastic surgeons usually treat the wound. They have reconstruction ladder, but with the help of advanced wound healing methods, we restrict our surgeries from extensive to minimum and to improve the outcome. This is the time consent. Thank you. Thank you very much. Thank you very much.
Thank you very much, Dr. Naphade. It was indeed a very good learning session for all of us, and especially our hyperbariatric oxygen chamber, which is like, forgotten thought which has come up again. Thank you so much for the session.
Thank you, sir, for a wonderful session. I would request Dr. Akshaya Jain and Dr. Dhairashil Patil to please come forward to felicitate sir. A big round of applause for sir. And I would request Dr. Chinmay Eram, Medical Superintendent, Manipal Hospital, Baner, to please come on the dais to felicitate our chairpersons. Thank you, Dr. Akshaya and Dr. Dhairashil Patil. Thank you, Doctor. For our next session,